welcome back to another episode of Tech Sheck, barreling very close to number 100. Wow. And guess what? We thought we got rid of COVID. It's back, but hopefully now we're coming to the end of it. But with that, we want to keep talking about interesting stories. And today we said, let's focus a little bit back on North America. I wanted to introduce Mr. Khan Siddiqui, actually Dr. Khan Siddiqui, who is the founder of Hyperfine. Welcome to the show, Dr. Khan.
Thank you very much, Faruk. It's great to be here.
Well, it's good to have you on the show. And as we do Tech Check style, let's jump right in. Tell us, a lot of hoopla around Hyperfine. What is Hyperfine?
Yeah, Hyperfine is the world's first portable MRI scanner that is cleared by the FDA and used clinically today. About 7 years ago, Jonathan Rothberg, one of the famous scientists from Yale and serial entrepreneur who's launched Butterfly Network that also went public, Ion Torrent before that, Quantum SI, had this idea and vision that, why can't advanced imaging go to the patient's bedside? It really, shook us to think about how would you actually do this? So Jonathan founded the company in 2015, and with this vision to how do you bring portable MR scanner to the patient's bedside. What we're trying to do is we're trying to find a niche where access to imaging is closer to the patient in time and in space, like go where the patient is. As you know, right, most of the healthcare is becoming patient-centric, and not just from a home point of view, but even inside the hospital, sometimes very challenging to get the patient to where the technology is. And to us, Jonathan's vision ended up being, how do you get advanced sensing, imaging, and robotic image-guided therapies to the patient globally, worldwide, and make it accessible, affordable to everybody else. And that's kind of the vision of Hyperfine, is to not just disrupt imaging, but sensing and guided robotic automation for therapy purposes. If you think of it, right, imaging is there, but if you're thinking about scenarios, even in rural America or in sub-Saharan Africa, how does somebody know you need imaging? So that's where our focus on sensing, to build sensors that are able to detect this patient needs imaging. And then once you've done imaging, the next step always is therapy. So how to use that image to guide robotic therapy in an accessible, affordable manner, so masses can access to it. So that was the vision. 5 years of R&D, and here we are. We have commercialized the system. We are cleared in Canada and in the United States, so we are full speed ahead, and that's the story.
No, that's fantastic. That's fantastic. Yeah, it's very unique, and the good thing we always try to do here at Tech Check is to highlight how our Pakistani ingenuity plays into these things. So my next question boils down to how. It's a very long-winded. It could be a very long-winded answer. So I wanted to get kind of an encapsulated version from you. Is what brought you to the state to go take the company public first before really actually rolling the product into the market?
Yeah, it is a long answer. So my current role at Hyperfine is the Chief Medical Officer and Chief Strategy Officer. Just to give you a little bit of my background, that'll give you the context of this stuff. So
sure.
I did my med school at Khan University, but I've always been interested in tech, even before I went to med school in Pakistan. And as my career evolved, I trained as a diagnostic radiologist at NYU and at Geisinger Health System. I moved more and more towards informatics as my academic career. Clinical work was all in cardiac MR, and body MR, and most of the academic work research was all in informatics. I became the director of informatics at UC Maryland, as well as director of MRI, and then director of biomedical imaging informatics at Hopkins, and associate professor of radiology there. And that's when, my whole academic focus became machine learning, computer vision. And this is 2003, 4, 5 timeframe, right before anybody else was doing AI stuff. And in 2007, I got recruited by Microsoft to come and start Microsoft's first healthcare AI team, and did that for 5 years. Worked on Xbox related stuff, Azure related stuff, focused on healthcare aspects of it. Left to start Higi, that we also recently sold to Avalon Healthcare, and that's also public now. And then about 3 years ago, got a call from Jonathan to help with this idea of MR scanner. And so that's what I've done. Come on board, build a team and the product getting through regulatory FDA. I think as I came on board and thinking about the strategy with Jonathan, one of the things was that are we an MRI company or are we a care continuum company, solving the entire aspect of it? And up till now, till I joined, it was more focused on MR side of things, and we kind of expanded that vision to include sensing and robotic guided interventions, and that led to us thinking like, okay, fine, we will need a lot more funding to be able to realize the entire continuum vision. And we're thinking of our chairman Scott Hennigan likes to say, what's next digital surgery, right? Are we building a digital surgery platform that requires imaging sensing and guided robotic automation and intervention? So that's kind of how this started. And the question became, how do we do this? And then we weren't actually looking for a SPAC-based transaction, but we got approached by multiple SPACs at that time. And Healthcare Catalio Acquisition Corp, or Health4, is a very well-known healthcare investor, 10 billion in assets, mostly focused in medtech. And they were an amazing partner. We thought credible investors. The SPAC was had very credible, well-known big brand names on it, and they all had a long-term vision. We spoke to everybody before we even jump on this ride, and we decided, okay, fine, we'll have to go raise money anyway, so might as well do it this route. And that's what led to it. And plus, Jonathan just done 2 SPACs, one with Butterfly, one with Quantum SI, so we had a lot of experience on the team to go through it, and that's what we did.
That's fantastic. That was a great story, and it's a true testament to just kind of being committed to a track, and then leveraging your background and your environment that you've worked in. Really helps you kind of focus in on the technology aspect of this. And I do recall you and I discussing that, and it's really great to see. So I guess my next question is now, where do you see Hyperfine in the next 3 years? What's happening?
You can see our public presentation that we did as part of the going public process. We see the vision behind this, right? We started with MR first. We are working on non-invasive continuous monitor for brain, so that will do intracranial pressure and cerebral blood flow measurement, just like an EKG does for the heart. I mean, it is pretty insane, right? When you have a stroke, the first thing the EMT does is put EKG leads and blood pressure cuff. There's nothing you put on the brain to see what's happening there. These are all proxy indicators of what is happening there.
Sure.
And so if you're worried about stroke, put something on the brain to understand what is happening to the blood flow, what's happening to the pressure in the brain, so you can act accordingly. So that's the idea behind that. And then in parallel, as you're going through use of a device inside, there's a lot of attention from neurosurgeons who want to use it intraoperatively or for procedure guidance. And that's the other direction where that's probably longer term vision to build image guided robotic interventional system. So that's kind of how we see it growing. And our focus really is focus on the core continuum, right? So if a patient as well as the physician taking care of the patient, how not just do the imaging portion of it, but what happens before and what happens after. And we're kind of solving the problem for the entire care continuum for patient as well as the physician.
Interesting. You picked up on some very unique things. That's some of the technology and the way we apply things today are things we've been doing for decades, right? And we're not really leveraging that technology go to the next level. Very cool. That's an interesting something I learned today, which is great. So, as you know, we try to keep this relatively short. Khan, last question for you. You are a serial, what I would call medical entrepreneur. Any points of advice for people who are running down this track? We have lots of Pakistani doctors in this country, and I'm sure a lot of them are looking at entrepreneurial tracks too.
I think it's very well known what leads to success and what leads to proper. So number one is you really need to understand your problem, right? What problem you're going to. It's not the idea, it's not the solution, it's the problem. Mm-hmm. Number two is the timing. Is the market right? Like like with all the AI advancements, and to be honest with you, our scanner would not have been possible if EV industry had not figured out and current management and battery power stuff had not happened. We would not have been able to create what we did, right? AI had not happened, we would not be able to do what we're doing right now. So there's timing is number two, and then market ready for these kind of scenarios. And COVID kind of accelerated the need for patient not moving around the hospital and infecting everybody else, right? So the timing is number two in my mind, and then number three is the team, the strategy, and the culture. So those four things are more important, or four or five things are more important than what exactly are you doing and how you're doing it. It's the why you're doing it. What's the problem and why are you focusing on the problem? What's the team? What's the culture? And what's your strategy to solve that problem? But the other thing is that humans think linearly, right? So we're not born to think exponentially. And that how do you think about your execution in an exponential manner, which is very deliberate and thoughtful, is what helps you scale.
Man, phenomenal, Khan. That's really, I really enjoyed the answer. I feel like I've learned a lot today in this session, and I really want to thank you for coming on.
Thanks, Faruk. It's always a pleasure.
Likewise. And to our audience, as you can see, we're always trying to bring unique aspects of what's happening, even related to the Pakistan tech startup ecosystem. And what we're hoping is episodes like this inspire young people there to continue to search and look for new and unique answers to existing problems. And with that, please continue to like, share, and subscribe. We're getting lots of momentum. We want to continue on that wagon. Thank you very much. Allah Hafiz.